What we're seeing is that transmission is occurring in all different kinds of settings, particularly where people are not following distancing, masking, or other requirements. So specific to sports, certainly we have seen transmission in some fitness facilities and in some team practice settings. It's always a bit of a challenge because often, especially with a team sport, unfortunately there can be not just the structured practice, but if there's any kind of socializing before or after the game, sometimes that can be the culprit for transmission. So my first message would be that it's critical that the current requirements of masking, distancing, all of the things that are needed to happen are applied every single day when people are engaging in fitness activities. Fitness is a critical part of both physical and mental health. And so it's not something that we want to restrict further. And yet, of course, we know, again, we see spread happen more often indoors than outdoors. And again, not just in fitness, but other settings. So we're looking at all of those pieces of information with respect to variants. Again, we're seeing that if measures are followed to the T, that can still prevent the spread of variants, but when measures slip aside, what happens with variants is they usually spread to more people who are present in that location. So we, again, need people to follow all of the measures. And with respect to whether or not we need additional restrictions, again, that's something that we're looking closely at the data to understand which restrictions, if needed, would have the biggest preventive impact on minimizing community spread.
The kind of behavior that's driving viral spread right now is non-compliance with the rules that already exist. And so, I was just down in southern Alberta where the medical officer for health said that what drove a recent regional spike there was large social gatherings in total contravention of the public health rules that are in place, of tightly knit communities, large and extended families getting together in large numbers, making no effort to distance socially, to wear masks, to move it outdoors, or any of those basic precautions. So, as I've always said, that compliance with the measures matters far, far more than the stringency of them. We could have a UK-style hard lockdown, which it sounds you might prefer, on paper. But if no one's respecting the rules, it doesn't matter. So the plea here is whatever the policy setting is, take it serious. I believe a lot of people just believe that this is pretty much over because of vaccines and weather and what they see in the States and other factors. Our message here today is it's not over. We've got a few weeks to go on the vaccine program before we can start to feel a bit safer about this. Please take it seriously. Once again, though, if we feel that it is, we've determined based on the expert advice of our public health officials and on the data that it's necessary to take additional targeted measures that could make a difference, we will do so.